So now we're going to talk about building healthcare data pipelines, and this won't give you the nitty-gritty of everything you'd need to do, but the idea is to give you ideas about what you can do, what you would want to do depending on who your customers are, and finally what legal constraints you might face depending on the sensitivity of the information you're collecting. Firstly, getting the data, right? You're in a healthcare organization of some kind. How do you get data? Where does that data come from? Well, firstly, you'll get clinical data, but only if you are working for a healthcare provider or another association that has access to personal health information. Personal health information is actually a technical term. It comes from HIPAA, some US legislation based on describing what you can and can't do with healthcare data. Most likely business applications in the near future are not using clinical data, and that's partly because the regulations are so strict. Either you're a clinician or a clinical provider or you're not. If you're in the business domain, most likely what you're going to be looking at is non-clinical data, such as self-reported data or data coming directly from devices. This can include clinical data that the patient chooses to share with you directly, such as test results or medical diagnoses. And if the patient shares them with you directly as a consumer-facing business of some kind, that is not protected health information. That's information they have chosen to disclose. So just because you're not a clinical provider doesn't mean you don't get really interesting and revealing data. Getting the data, what sort of data will you see? Well, data will take many forms. You'll get numerical measurements, things like somebody's weight and their blood pressure. You will also get natural language notes, and that can be whether you're getting clinical data or not. So if you are getting clinical data, right, if you are a hospital or a health insurance company, you might get those free-form natural language clinical observations of patients we've talked about. And if you do, those don't tend to be too standardized. Every clinician will have their own style. They will use the same technical terms, but how wordy they are, for example, will vary. You will also get natural language notes if you are collecting information directly from patients/customers, for example, mood journaling. Lots of people do like to have healthcare applications where they can add notes. So for example, with diabetes, people might want to label their meals as something like, I was feeling down, so I had a lot of carbs, or I was feeling great, so I had no carbs. Or people might be mood journaling for a mental health application of some kind. They might get up every morning and describe how they're feeling and want your application to do something meaningful with that. You might also get things like dates of health-related events. When did someone get a vaccination? When did they fill a prescription? When did they get a lab report? When did they have surgery? So lots of things are sort of categorical information, but with dates, and those dates are themselves meaningful data. And speaking of categories, you can also just get categorical labels that are true sometimes or true all of the time, such as someone being a type 1 diabetic, or someone having Parkinson's disease, or someone having a certain blood type. So those things will always be true once you get them, right? They sort of drop people into categories and they want you to keep track of that. And also I will mention medical billing codes, something you will deal with if you're dealing with clinical data. So why can pipelines be really interesting from a health tech perspective? Well, future pipelines, if they're built better than current pipelines, can be really valuable for a number of reasons. The first one, and again, this is very US-centric, but it is true of other systems, American healthcare has many points of entry. Value will come from unifying electronic health records so that data can be easily matched to an individual and shared among appropriate parties. For example, the last time I was in the hospital actually had 8 separate records matching my name with different addresses, and they sort of asked me to go through and identify which ones were me, because what had happened is there had been many hospital mergers, and these were all from when I was born up until my current age, and so it was really interesting to see that they didn't have a very good way to match those records other than asking someone to recognize them. Also, just like the healthcare system has no way to sort of automatically unify people's health records, patients don't have a single unified way to store their own data, and that's part of what they're looking for from health apps, right? So especially if you have some sort of chronic condition like diabetes or Parkinson's, it can be very frustrating that your clinical data is nonetheless spread out across several specialists. Maybe some of it you have, maybe some of it you don't, and it can be hard to actually just have a single record somewhere. So people really appreciate when an application on their phone or on their computer can offer this so that they have a history that they can see. Legal, sociological, and technological changes await in both consumer-facing and industry-oriented healthcare applications, but there is a lot that can already be done. Any sort of attempt at unification would already be really interesting. So that's something to think about as you craft your own ideas for health tech. I want to talk a little bit about HIPAA because that is extremely important to the US healthcare landscape. There's a few things to keep in mind. Requirements for electronic health records, right? So if you are working in some kind of clinical organization, you will deal with this as you build your pipeline. You need access control, such as passwords. You need encrypted storage. You need an audit trail to see who looked at records, when, and why. And if you do have a breach, you need to notify victims and the federal government. So these are very stringent requirements, not impossible by any means, but they will also mean that your data science team has limited access to this information, even if you do have a data science team in your healthcare organization. Requirements apply to health plans and healthcare providers and healthcare clearinghouses. So essentially anyone who is servicing a healthcare provider or a health insurance company has these requirements. This information can then only be used for research once it has been anonymized, and we will talk about anonymization in a little while. And finally, as a reminder, most electronic health records got implemented due to billing motives, but they also got implemented in a hurry due to financial incentives. So not only were they crafted for billing, but they were sort of crafted in a hurry. HIPAA and machine learning remains a somewhat gray area from a regulatory perspective. So covered entities can use or disclose personal health information for treatment, payment, and healthcare operations. However, it's unclear that AI can access the personal health information of other patients to treat one person. So for example, if I were to go into the doctor, it's very tempting to think, well, that doctor could just run this machine learning algorithm after she finds out a few relevant factors for me. It's unclear based on the way the law is written that someone else's personal information can benefit me without their consent. That's a gray area. Right now, the legal regime is that disclosure of PHI must be the minimum necessary, but AI actually, A, you can't always tell what is the minimum necessary, and B, certainly performs better when you give it more than what is the minimum necessary, right? The more information we give our algorithms, the better they can do. So under the HIPAA privacy rule, health information that is de-identified is not subject to the limits of the privacy rule. That's good news. The problem is that once you de-identify information from one database, you can't match it to another. And so then you lose whatever synergies you can get by merging health data sets. And when we remember how fragmented the healthcare system is and the fact that most people don't have all their medical records in one place, we realize that that's also a problem because that means your machine learning is only operating on short components of people's health histories. So thinking a bit about what your healthcare pipeline might look like, there's sort of red data, as I think of it, and green data, right? So the red data, that protected health information, you usually want to leave that to the professionals because of all these legal requirements. What you will get that's very interesting is self-reported data. This can come in free-form or standardized formats. It's best if you build an interface that will structure this data via an organized interface, right? So if you can take things that people might say in different ways and come up with a user-friendly way for them to all input it in the same way that feels easy and joyful and simple and uniform, you will make your life a lot easier and you will make your data scientist team a lot easier. And automated data collection, this is also a really rich source of information. These will come standardized and will give you the most reliable data because you know that unlike people, machines don't usually lie, although they can be broken. So you do still need to account for measurement error. So what a healthcare pipeline needs to consume from individuals are things like permanent individual attributes, temporary individual attributes, heterogeneous time series data, and free-form notes. So you can see some examples of those things. You want a pipeline that can take in all of these things, right? So when I say pipeline, I really mean many different parallel processing components. And then when you think what people want after they've supplied all this data to you, there's a few things they want that will be useful. One is summary statistics, right? So things like how many calories did I eat today? How many days did I miss my medication? They also want slices in time, right? So how does my overall health look now compared to, say, 6 weeks ago or 6 months ago? Have I lost weight? Am I getting better at taking my medicine? Am I exercising more or less? And for that reason, they also want trend spotting. So not just a slice in time, but sort of like, well, what's my health trajectory over the last 6 months? Is my blood sugar getting better? Are my stress levels going down? And finally, they also want goal setting and progress tracking. So I want to lose 10 pounds in 3 months. Please provide an automated way for me to see if I'm on track with that. Or I want to lower my resting heart rate because I'm a sprinter. Please track that and tell me if I'm making progress so I don't need to think about it. You also want to think about what you can do for entire populations, right? So you're taking in all this data from individuals, and if they're giving it to you freely, you don't have these legal requirements of anonymization, then you can do interesting things to talk about communities as a whole. So you can tell people what you've learned from their data and everyone else's. For example, research results, right? Maybe you do research on type 1 diabetics or on people with high cortisol levels. You need a way to find out who those people are within your data set and get the information back to them. You also, with aggregated population pipelines, can do things like think about research consumption, right? So if you have 5% of an entire city giving you health data, you can actually figure out for that city what the health needs are and where they're going to pop up, what neighborhoods might need more syringes, what neighborhoods are going to see problems with the flu, and help hospitals get a handle on their resource consumption. And finally, you can just get these generic population counts, right? So if you're getting all this parallel data from people, you can do things like figure out what is happening where, even unrelated to resource consumption, and that's also very useful. So this would be sort of a dream pipeline where you are both doing things for people individually that are interesting to them, and also then doing things where you can make statements about the entire population that are useful both for the individual supplying your data and also for healthcare institutions.